I'm Dr. Jamie Kaufman, and this is Dr. Kaufman's Reflux Hour. Today the topic is going to be voice disorders, and what a lot of you don't know is I started out as an ear, nose, and throat doctor, and then I heard there was a laser, someone doing laser surgery, and I went and I saw that. It was just incredible. See these big vocal cords on a big screen and a little nodule with a zap through a microscope from outside the patient. The nodule went away. So I became a laryngologist, which is someone who specializes in laryngeal and the voice. And I had the second, possibly the first laser in the United States after they were reclassified from being experimental tools. And that was 1978. And by 1981, I had a national practice. I was being invited to talk all over the country about lasers. And so I'm a laryngologist. I developed laryngeal reconstructive surgery. I did a lot of the groundwork for a lot of the different fields that are related. And obviously, one of them was reflux, acid reflux. And the reason that came about is I found patients that were doing poorly after surgery or came to me with what looked like inflammation in the throat, not just the larynx. And anyway, to make a long story short, I borrowed the technology to measure acidity, and we put a pH probe in the esophagus and one in the pharynx and proved there was such a thing as reflux in the throat. And patients didn't have heartburn, didn't have indigestion. So in '87, I came up with the term laryngopharyngeal reflux. That term has stood the test of time in the sense that that's what's used in the medical literature. And I propose changing it to respiratory reflux. That means reflux in the larynx and pharynx LPR. What about the sinuses? What about breathing problems? So the term respiratory reflux is I think, a pinnacle term. Now, so let's get back to voice disorders. I think respiratory reflux is so common that otolaryngologists don't know what it looks like. Many times I've given a lecture and I've put up a mild reflux laryngitis, mild to moderate, and said, is this normal or abnormal? And two people in the audience put up their hands, two people. So nobody was putting up their hands for normal or abnormal because they didn't know. And then click, next came the next picture with the same patient with beautiful, pristine vocal cords looking like the bow of the ship, nice and wet, white. So I believe at this point now, since there's no test for respiratory reflux, I mean, if you go to a gastroenterologist with respiratory reflux, they don't have any test for it, they don't have any treatment for it, and they don't really want to see you. And yet, it looks like for every patient who has heartburn and indigestion, there are going to be 5 or 10 people with respiratory reflux. And then everything from pseudo-asthma to swallowing problems to post-nasal drip, sinus problems, it goes on and on and on. So all these things can be reflux related. Number one is the voice box. So let's talk about the voice box and the vocal cords. The number one symptom of respiratory reflux is a postnasal drip, too much mucus, chronic throat clearing. We've all seen people on television get a glop of mucus on their vocal cords, and it really affects the voice. And they hope they can get rid of it fast so they're not sounding like they're choking or trying to get rid of this mucus for an extended period of time. I've heard presidents do it. So mucus can get on the vocal cords from reflux. Reflux, respiratory tract, respiratory reflux has mucous membranes lining it. And when irritated, those mucous membranes make more mucus. So the first topic I want to talk about is mucus and the voice box. And I've just given you a picture of what happens when this thick mucus gets on the vocal cords. You got to get it off of there. Meanwhile, those same people who have reflux, respiratory reflux, also have swelling and inflammation of the vocal cords. And I'm writing a book now called Respiratory Reflux, the Cause, Cost, and Cure for America's Silent Health Crisis. And so what I'm saying is that this is a big hole, And here's why I tell you all the time. The air digestive tract means the respiratory tract and the digestive tract are one, and they're connected here in the throat. And guess what? There are 3 different specialists. So we have otolaryngologists, pulmonologists, and gastroenterologists. So, and then furthermore, the gastroenterologists are still interested in putting scopes down people and putting them on proton pump inhibitors. So if the go-to doctor knows nothing about respiratory reflux, what makes you think your ENT or your pulmonologist would? So post-nasal drip, chronic throat clearing, and some swelling of the vocal cords. Swelling of the vocal cords usually causes a drop of pitch, a little vocal fatigue perhaps, and it's subtle at first. But if you're a teacher or you use your voice all the time, it's a problem. And if you're doing 8 shows a week on Broadway, it's a big problem. So reflux laryngitis is very common. For people who don't know much about reflux, but they love to go out and party on Friday and Saturday night, and they wake up in the morning with hoarseness and mucus, that's called whiskey voice. So reflux laryngitis is a big deal, and it's very, very common. I don't know what percent of the population has it, but I'll bet it's high percent. It's got to be above 20% of the 10-20% of the population has mucus and all of this with them. Mild alteration of the voice. When I ask people, well, it's always been like this, and then the partner usually says, no, it started getting deeper like this about 4 years ago. So it's subtle. That's subtle. But if you have a lot of other reflux symptoms, then you have to have it treated. It's part of a constellation. So reflux laryngitis needs to be treated by reflux treatment. Reflux treatment is diet and lifestyle. I've said this before also, and I'll continue to do so. Reflux is self-sustaining, and it's going on like this, and then you get an upper respiratory infection, and the voice goes bad. You get COVID, and you start to get a chronic cough. So, but there it is, basically like the base of an iceberg waiting to pop up. If you're going to stop reflux, you have to stop at 100% for, let's just say, a month. We know you can wash out pepsin in about 3 weeks. And that's what you're doing. You're washing out pepsin. It's a pepsin that causes the problem. So that's why you shouldn't be drinking any carbonated beverages, because they're all low pH, acidic, and you have pepsin stuck in your tissue, and it reactivates the pepsin. For those of you who haven't seen it, you need to look at my blog, jamiekaufman.com. The last article on alkaline water, the man is made out of water. That article shows the biopsy of someone with reflux laryngitis, and it shows a huge amount of pepsin. It's intracellular, extracellular, not just on the surface. And I also recommend a spray bottle to help, because pepsin dies at pH 8, and you can spray pH 9.5 or higher. And so this is a real important adjunct for people with voice problems. And in other words, when you swallow, you don't get any alkaline water in your throat and none on the voice box. It clamps tight as your fist so you don't aspirate. But if you just lower your tongue and spray, this is actual treatment. Pepsin dies at pH 8. This is 9.5. On my vocal cords. A lot. So this is a big thing on Broadway now. A lot of the singers are carrying little blue bottles around. So, how did I first find out about reflux? I was 1978-ish, and I was called urgently to see a patient in the hospital, and I carried a little box and a scope so I could look down, and she was gasping for air. She couldn't get air, and I looked inside, and here are the vocal cords, and there were these 2 big granulomas, round, big, proud flesh-looking things. And I started wheeling her out of the room, and I told them, call the OR stat. I want to be in the laser room. I need now. And so I got her down there to the operating, literally rolled the gurney myself, and we used jet ventilation, so no tube, just blew air in and out, and the chest went up and down. And I went, bzz, 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 took out 2 granulomas, and that was it. So the granulomas can be large, it can be small, but they're almost always caused by reflux. So they recur. So if someone has a reflux problem and granulomas, when they start to affect the voice, that's a bad thing if you're a news announcer. So those kind of people need to be on a tight reflux program for a long time. Remember what I said to you, adding something. Well, I've been taking the famotidine and following your diet, and I still have hoarseness, and it looks like I'm making another granuloma. That's not enough. So, as you look through my work, you'll see this a thing called reverse intermittent fasting. You'll see these articles on detox diet. You'll see these articles on famotidine and alkaline water. So it's a big program. And so people ask, what do I do when the program's over? It depends who you are and what the problem is. If you're a professional singer, you're going to have to be on a reflux program the rest of your life. I mean, you're not going to be able to go out to dinner at 9 o'clock after a show and have 2 cocktails and a steak with a big chocolate dessert, and you're going to reflux all night. And you're going to sound awful the next day. And spraying a little alkaline water is not going to get it done. So this is the first thing I want to tell you as the group of people who listen to me and are interested in reflux. It's not a one-time deal. There are people that I have, particularly young New Yorkers, who they do the detox program, and then over the course of the year they dwindle down, they do another detox program. But the truth of the matter is, after you do the detox program, and it's a program, it's not just a diet, you have to add things one back at a time. Maybe you need to sleep high. Maybe you need to get a bed that goes up and down. Maybe you always need to eat early. Maybe you always need to take an alginate before bed. So there's not a one-size-fits-all for the long-term treatment of reflux. If you have Barrett's esophagus, you ought to be on all of the program of all of your life. Do get the bed that goes up and down, alkaline water, a pitcher, so you don't have to keep toting bottles. So reflux laryngitis with granulomas is common, and the granulomas can be recurrent. And when they're recurrent, instead of you can zap them off if they're causing problems. But in my career, I've seen many granulomas go away when the patient got on a good anti-reflux diet and lifestyle. So next comes polyps. And polyps have a special name. They're water baggy vocal cords. And this is the Harvey, what's his name? Firestein voice, Louis Armstrong voice. And you can't imitate that voice. These 2 water bags are flopping back and forth. It's also called Rinke's edema. And the cause of that is reflux. By the way, there's a second cause, which is hypothyroidism, but it's big hypothyroidism. I've only had one case that was cool. It's a patient of mine, reflux patient, who was doing fine, and she, from the eastern part of the state. She comes back to see me, and she didn't have big polyps before, and she was on thyroid medicine. So I said, how much thyroid medicine do you want? She said, 0.25. I said, when you get home, call me and tell me what the bottle was. She was getting 1/10 of what she needed, and so with really severe hypothyroidism, she made these big polyps. Smoking causes polyps, and they can be from voice use and misuse as well, and you can combine all of those things. When you remove them, and you do have to remove them, and there's many ways of removing them. You can't be refluxing at the time, or you're liable to get vocal cord scarring, which is permanent, will affect the voice forever. Think Julie Andrews in this case, although she didn't have polyps. So vocal fold polyps they look like wet bags, they're too big, they flop around, and they give a very raspy, low-pitched voice, and for most people they're caused by reflux, long-term reflux. Now here comes one that's an issue. Vocal nodules. So you're a professional singer, you're a taxi driver who likes to talk, you're a trial lawyer, and your voice starts to get raspy, and someone says you get vocal cord nodules. Now these little nodules are symmetrical, and they're in the middle of the vocal cords where the vocal cords basically meet. It's like where the jumping rope hits the bottom of the ground. Those nodules, they send people to voice therapy, and they do all these things. They do surgery on them. I recommend reflux treatment, 6 months. Voice therapy doesn't help particularly in my experience. These people are not vocal misusers. If they have a maladaptive compensatory set of behaviors, then voice therapy is fine. But and they sometimes do need to be removed, depends upon how mature they are. And there can be hemorrhagic nodules that are on one side. So what I'm saying to you is reflux are related to these things. So if people have nodules and they're professional voice user, and by the way, 70% of us are professional voice users. We looked at it some time ago, and 7 out of 10 people are professional voice users. You know, if you climb up a ladder by yourself and trim trees, your job doesn't involve being a professional voice user. So the next one I'm going to talk about is going to be difficult to explain. So vocal cord paralysis happens. It can happen because you have a thyroid tumor and it has to be removed because it's cancer, and the nerve to the vocal cord runs right through the thyroid. It can happen with neck surgery, fixing the carotid artery. It can happen with a lot of things. It can happen with trauma. But most of the time it happens without obvious cause or following a respiratory infection. This happened to me. It was a Christmas 30 years ago. I had terrible flu. 2 days later, I had no voice. And I examined myself, and my left vocal cord was paralyzed. It's still partially paralyzed. And then I got reflux, and then I got a cough. So before the virus, I never had a voice problem, a cough problem, or a reflux problem. And so we call that post-viral, vagal, it's the vagus nerve, neuropathy. And if you go on the website, jamiekaufman.com, there's a 3-part article on the vagus nerve, and in my opinion, it's the only article on the internet on the vagus. Everything else is silly. We're going to do these exercises and strengthen our vagus so we feel happier. All of this is what you call medical bull. So there's very little information, so I've provided it. And by the way, it's not my best work. I wrote that article, it's a 3-part article, as a first draft for a chapter in my book. And then I figured out that we don't want everyone to think they have vagus problems, so I stuck it in the appendix and just mentioned it in passing. But vocal cord paresis, or partial paralysis, is common. We did a study, and we found out that, I've never published it, how we did the study was very ethical, and we found that 40%, roughly 40% of the population has vocal fold paresis. I have vocal fold paresis. As I speak, my vocal cords are getting a little swollen today because I'm a little more energetic, and they don't come together very well. So I have to use extra work to get closure. So partial paralysis is very common, and when you add it to reflux, you can say maybe the viral infection caused vocal fold paresis and reflux, and it started at that time. So post-viral vagal neuropathy is common. Nobody needs treatment for the vagus nerve, okay? There's not a treatment that'll make the vocal cords, the vast majority of them heal and come back within 2 years. So if this, for example, I had a paralyzed vocal cord, and now it's only half paralyzed. So paresis means partial paralysis. And it's very common. I mean, it's usually seen with reflux. And I will tell you that I've seen hundreds of singers with vocal fold paresis that are doing just fine, as long as they don't have reflux. So it's very common, vocal fold paresis. Now I want to talk about some lesions. Papillomas, recurrent respiratory papillomas. When I first went into practice, I had this laser. There was one in Chicago, one in Boston, and me. And I was doing 17 cases a day, and most of them had subglottic stenosis, scarring, can't breathe, and papillomas, which can grow and obstruct the airway, mostly in the larynx, but in the trachea as well and elsewhere. And I would be lasering off these. I had one kid that I had to laser every 2 weeks to keep him alive. And at some point in his life, it stopped happening, and we don't know why, but may some of it have to do with recognition of reflux at that time. So the last one I want to talk about, there are others. I want to talk about vocal fold dysplasia and cancer. So the vocal cord, here's a case that I think is very instructive. And it's an old case, so I get some of the details wrong. It's in my trialogic thesis, published in '91. 40-something-year-old businessman came to see me with a little plaque on one of his vocal cords. It was white, and I removed it, it was a small microinvasive squamous cell carcinoma. So he had a little granulation tissue, a little longer than he should, and instead of healing in a week, he healed in like 6 weeks. But he healed. A year later, he comes back and he's got a little one on the other side. Same thing, microinvasive carcinoma. So I took that one off, no problem, healed quickly. Another year passes, he comes back with another one. So after 4 little carcinomas, I'm now, remember this starts early, I'm now thinking about reflux quite seriously. So we did reflux testing on this man, and it was off the wall. We put him on a program, and we sent him to have a fundoplication. We want everything for this man. So even with good diet and early eating and all the other things we do, he had a fundoplication. That's the guy who should have a surgery. And he never had a problem again. Now, I can't say never, but I had at least 5 years follow-up. So here he was making a new little cancer every year, and then treatment of his reflux, and it all stopped. So if you ask me about cancer of the larynx, vocal cords, cancer of the lung, particularly in non-smokers, and of course we know cancer of the esophagus, you can get cancer without smoking, but not without reflux. So reflux, in my opinion, we've done work now that shows that if you put pepsin, and it's pepsin, in tissue culture of laryngeal cells, you see upregulation of all of the cancer markers. So reflux is important, and it's peptic reflux, and we want to get rid of our pepsin. So what you do depends upon what you do. I mean, if you're an opera singer and you've got reflux, you're probably not able to work. Your voice is affected sufficiently. So you need a program like a saint. You're eating at 4 o'clock in the afternoon or earlier. You're going to bed on an incline. You drink alkaline water all the time. You take famotidine. The whole program has 8 pieces. So diet and famotidine, only 2. The question today, I'm taking famotidine, I'm on a good diet, why am I still having problems with my voice, actually? And the answer is, that's not enough to cure your reflux. So, I just want to tell you, I'm working on a new book, and that explains why I used to blog every week. I put out a new blog, and as you get older, it's harder. And this writing the book at this stage is very much like when you see people climbing Mount Everest, that last 1,000 feet where every single step it takes effort. So I've stopped blogging. I'm working on the book, and it has an interesting title. We changed the title. It used to be Respiratory Reflux, How Silent Reflux Causes Diseases. Now, it's Respiratory Reflux, the Cause, Cost, and Cure of America's Silent Health Crisis. So we'll see if it gets any attention. It will certainly make otolaryngologists, gastroenterologists, and pulmonologists mad, because it basically says they're pretty much incompetent when it comes to this problem. So with that, which is probably not the best ending for a didactic portion of this program, I'd like to answer some questions, and some of them are very good questions, and some of them are repetitive questions that don't make sense, but I get them all the time. So this first question is, in your blog, postnasal drip, allergy versus reflux. Allergy is thin, it doesn't get on the vocal cords. It's not it's nose, it's sneezing, it's itchy, eyes. It doesn't really cause vocal cord problems. So reflux, it's thick, hard to move. That's reflux. Okay. There are other things that cause it, but 99% of the time it's going to be reflux. So he's got postnasal drip, and he wants to know, he's been on a anti-reflux program for 6 weeks, and he wants to know why he still have mucus. And I tell him 2 things. First of all, I don't know if your anti-reflux program is tight. maybe you're eating the same thing every morning, and one of those things is a trigger food. There's a lot of reasons why people fail. And so he wants to know, and I've given the analogy before, that this symptom of postnasal drip, too much mucus, is slow to go. It's not gone in 3 or 4 weeks, even if pepsin is washed out. And the reason is those little glands are like wartime factories, and they're hypertrophied, and they're putting out more mucus. So it usually takes longer for that to go away. So two opportunities for failure. One is your reflux treatment program's not tight enough, or you haven't waited long enough. Will the diet work for GERD? Now, when I say GERD, I want to get rid of that term, because it's been a wastebasket for reflux. And they put LPR in it, and respiratory reflux in it, and all the other terms, extraesophageal reflux. So I think it should go away. It's gastroesophageal reflux disease. I think we should have 2 terms. One of them ought to be respiratory reflux, and the other one ought to be esophageal reflux. And GERD ought to fall by the wayside. But in this question, the assumption is that this person has heartburn and indigestion, because that's GERD. And taking famotidine, and the question is actually not so much about her treatment program. The answer is yes, the program works for GERD as well as it works for respiratory reflux. And she wants to know about taking her thyroid medicine and the famotidine. She's got Hashimoto's, so 3 things to say. Number 1, take your pills all at the same time. All that, like let her wait an hour and all that. Never done that with any patient ever. And if the thyroid is off a little bit, they'll up it or decrease it next year. But I never felt that was important. And so you can take all your pills at the same time. How much time between each? None. And the next question is related to the Hashimoto's. Is there a connection between reflux and Hashimoto's? And the answer is, I don't know. But if you haven't read my article on acid reflux and gut health, I learned a lot when I was looking at that question, because people were asking it. The microbiome, that which lives in the gut, is very important in all diseases, including Alzheimer's and autoimmune diseases, inflammatory diseases, and so on. And so what does that mean? It means that there are bacteria in there that change something you've eaten so it can be absorbed. That's good, perhaps. Some things you shouldn't absorb are captured so you don't absorb them. And so the microbiome in people who have acid reflux is bad. How do I know it's bad? Because we see Candida albicans, white plaques in the esophagus and the throat, not infrequently. And you've got to kill a lot of the normal flora to get Candida to grow in the throat. And so I think there's a good chance that reflux has a big impact on it, including things like gastric emptying, overall motility. And I do recommend a good quality probiotic for everyone who's got reflux, maybe for everyone. Anyway, the Hashimoto's doesn't have anything to do with the reflux, or vice versa, unless it's linked somehow in the microbiome, and it's possible, but I don't think it's related. Voice became very hoarse 24/7. What sent me to an ENT. I was diagnosed with LPR, so my voice change was definitely connected to LPR. My question is, can electrolytes, compression underwear, and extra salt cause LPR? The answer is no. Okay, there are very few medicines. Antibiotics and steroids cause reflux, and they're often given to people who have lung problems and chronic cough. I think chondroitin and glucosamine for joints is bad, and B-complex vitamins. The vitamins you really need, I think, are probably just B12. But in any case, the things that you've mentioned, in my opinion, don't have anything to do. I didn't realize someone asked this question. Is Candida yeast infection connected to LPR? ENT scoped me twice and says, no signs of LPR, but I have Candida. So, listen, if you got Candida, you got prize-winning LPR. So, again, the way I put it is in otolaryngology, reflux is so common that most otolaryngologists examining the throat don't know what a normal one looks like. They just don't see normal throats. That's really possible. So, Candida is a problem. I'm finding that I'm sensitive to gluten and I have symptoms of LPR, although no formal diagnosis. Can you comment on gluten sensitivity? I wrote about bread and sugar reduction in my 2023 book. I don't know the answer. I just don't know. I do know that gluten sensitivity is far broader than just how it affects the bowel. It can affect things like scleroderma, psoriasis. It can even, there's a big association with ataxia. The articles were written, they're English articles. So it's quite possible that gluten sensitivity will have connections to other things that we're not able to prove. I think you do is you go on a gluten-free diet for 6 months. It's not easy, by the way. I was going to go on a gluten-free diet for several years. I love this question. Can you talk about the reliability of Pep Test, please? So Pep Test is you spit in a cup and you send it across the pond to England and they look for pepsin. It's a lateral flow test, just like a pregnancy test. So first of all, it's my test. I developed a test. I patented the test in 1996. The guy who went and put it together, Pep Test, I was sitting at my computer and I came up with, how about calling it Pep Test? So I named it, it was my assay. I still had a patent on it, and this guy started making it in England because they knew I wouldn't sue him. But I also wasn't going to take it to market. Why? A single spit in a cup test is just a moment in time. Same thing with pH testing, right? pH testing comes back normal, but that's a Thursday. Patient goes out Friday and Saturday night, and reflux is like a bandit because of bad things. So the answer is, I think the Pep test is only reliable, perhaps. I mean, I've seen it normal people, positive Pep tests, and people with terrible reflux, negative. So I don't think it's a reliable test. And it's my test. It is mine. I spent years and years and years developing this pepsin assay, and I don't use it, and I've stopped using it. And the guy who took it really just sort of took it. I asked him to send me a big check, and he won't. So anyway, I've lost my falsetto, and I gargle with alkaline water and a little baking soda to loosen up the thick mucus prior to singing. I'm able to sing for 4 hours. My hoarse voice is gotten. Basically, the question is, what do you do? So, first of all, you don't need to put bicarbonate in anything. Alkaline water is readily available. Alkaline water drops. You go on the website, mine, look up alkaline water. There are 4 articles there. You need to be on a reflux program. You know, you can't go out to eat and have a cocktail after you're singing an event. I don't know if you're professional. I don't know if you're doing 8 shows a week on Broadway, or you're, it doesn't say that. But I think it's very important for people who are professional voice users to know you may have to make some changes to your life. It's after the detox is over. Here's an example. They say, what do you hate the most? Well, I don't like all these pillows and sleeping on an incline like that. I say, fine. Just go down on 2 pillows and leave everything else the same. And if you start refluxing again within the next few days, leave everything else the same, you need the bed that goes up and down, or at the very least, a recliner. Well, time's almost up. I want to end by asking this question, because it's answering this question. Strata is a procedure where they, for all intents and purposes, cook the area of the lower esophageal sphincter. It's not really cooked. It's radio frequency. But in any event, I was for it for a long time. And none of these procedures are long-term fixes. Just like, Ozembic's not a long-term fix. By the way, those drugs, they make your reflux worse. Ozembic is the worst. There's an article on that on my site as well. And by the way, every time I do this, I go to the first thing I type in is PubMed. So I want to see peer-reviewed articles. So someone is saying that this makes a big difference. They're doing reflux testing, and the reflux testing is better in the people who had the strata 3 years later, but they both have significant reflux. So, if you're refluxing 20 times a day, that's not better than 50 times a day. It's trouble. So the data is very, very, even published data is not clear, but it doesn't look like that. It's a big long-term winner. I think the one with the Magnus you ought to avoid like the plague, the Lynx procedure, and when that fails and you have to have something else done, or if you do, there's big trouble and it's hard to do. So listen, I got a lot of more questions here. I sure would like to answer them, but I'm going to save some of the best ones for next time. And so I'll see you next month. And the topic next month will be, I don't know yet, okay? Thank you all, and 3 things. First of all, use the website as a resource. You can type in hiatal hernia and up will pop an article, okay? And tell people about it. You don't need my books. The newest book, Respiratory Reflux, is up there on that internet. And the other thing is, if you're really having trouble, you can do a consult. I still do virtual consultations, which most people don't know. So anyway, everybody have a nice fall, and I'll see you next time.